Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, we got another true malpractice stories. This one is about what's called the most dangerous hospital in the world. You're going to want to see this one. And then a surgeon has his own healthy legs amputated. This story is really bizarre. And then finally, we're going to do some plastic surgery news recaps, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button and turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is Sarah, as always.
Hi.
Hi, Sarah. How are you today?
I'm good. How are you?
Doing very well. In the box, we got Andrew. Brenda, I guess, is on vacation. Andrew, is that right?
I believe so.
Good for her.
Okay.
Much
all right.
deserved. Much
well,
deserved.
Welcome. You haven't been on with us before, have you?
I don't think I have. No.
All
First
right.
time.
Well, very exciting.
Fancy.
We got some good topics today too. So, man, just jump in there whenever you want.
I got you.
Yeah. Cool. All right. Sarah, anything good this weekend?
No, but today's October 3rd. You know what that is, right?
No.
Taylor Swift's new album came out.
Oh my gosh, did I miss something important?
Yeah, it's all over everything.
Taylor Swift's new, I did see some.
I didn't stay up to watch it though. I mean, to listen to it. I just, woke up this morning and me and Avery blared it.
What's the early buzz? Is it good?
I love it so far. All the ones.
All right, I'm not a Swiftie. But yeah. I do like Taylor Swift's music. I mean, it's catchy. I mean, she writes, I think, a lot of her own songs.
This one's really good. It's more upbeat.
Okay.
The last one was really kind of melancholy.
It
was kind of sad and acoustic,
Yeah, this one's a little bit more poppy.
This one sounds like it's the name of it's Showgirl, so it sounds very upbeat and kind of sassy. And the one before that was sounded like she was wearing a frumpy sweater in a cottage writing, which she probably, I think some of it was in the music video was like that. Yeah. So,
well, what's the name of the album?
Showgirl.
Oh, that's right. You just said that.
The Life of a Showgirl.
Yeah. I am not ashamed to admit that I kind of do. I don't have all of her albums and all that, but I do like her music.
When she's good, she's good.
Yeah, she's talented. Yeah. You can't deny that she's a really smart business person, which I obviously
100%.
I obviously respect that. But okay, yeah. Sarah, I'm making my chore this weekend to check out the new Taylor Swift.
That's your weekend to do.
That's my new weekend chore. Yeah. Mm-hmm. Yeah. So, all right, let's roll into some segments. So, we did a few weeks back a true malpractice story. So, we're going to roll on with that series, and this is true malpractice stories about the most, quote, dangerous hospital on the planet.
Is it in America?
It is in America.
Florida.
No, you're never going to believe where it was. It's
New York.
Not. Yeah. So this story is actually very tragic, and these things are always really sad because, at the end of the day, if you're talking about malpractice and somebody got hurt,
yeah.
But they're interesting, and sometimes there's things to be learned about them, and so I think that this is something that's worth at least discussing. And this one's pretty wild. I have never seen a judgment this large ruled by anyone for malpractice. This is an insane judgment, and sadly it probably will never be collected. But this happened back in 2019. A young woman named Anissa Zancanelli and her partner, I don't think they were married, but they were together, Daniel McMichael, were on a short vacation. They were from Wyoming, and they went to Salt Lake City for a short vacation. Now, there's a little bit of a problem here because she was over 39 weeks pregnant, and so immediately I'm oh man, why did she leave town for something that wasn't absolutely necessary? Because if you look at the ACOG, which is the American College of Gynecology's recommendations, they really avoid or really recommend that you avoid traveling in the last month of your pregnancy because problems can pop up where you have to go to this hospital where they don't know your medical history and all that. Mm-hmm. And this is just a side note because really everything that happened to her is just so far out of bounds that it doesn't matter. That this is just kind of a side note of, hey, be aware if you're in your late-term pregnancy, leaving town does carry some risks. But
right.
But that's not what caused this. So anyway, she was in Salt Lake City. 39 and a half weeks pregnant, her water breaks, she goes into labor. And so suddenly the family's kind of scrambling to try to figure out, like, where are they going to go? Because obviously they couldn't get all the way back to Wyoming at that point. So they found a hospital, and they ended up at Jordan Valley Medical Center, which is in one of the little suburbs there around Salt Lake City. So she gets checked into the hospital, right? Okay, everything's fine so far. And they put her on Pitocin. So Pitocin is also called oxytocin. It's a very, very commonly used medication to help women who are kind of in early labor.
Yeah, doesn't it like stop contractions a little bit?
Other way around.
It increases.
Yeah, it increases them.
Okay.
So what it does is, like, when the water breaks, in order to kind of speed along the birthing process, they'll put somebody on Pitocin, and it'll cause them to have more contractions, and it kind of just speeds things along so that, you know, the delivery gets to a point where you can actually deliver the baby. You're not just in labor.
And you're not like in pain for longer.
Right, yeah, it does speed things along. So she gets put on Pitocin, and you know, Pitocin is like a gas pedal. When you press the gas pedal and you start moving faster, you really got to pay attention to what's going on, right? Because as things start to move quicker, the potential risk of problems or complications starts to increase. Mm-hmm. So reportedly, and this is coming from a bunch of the news articles that talked about this, the two nurses that were responsible for taking care of her allegedly were both completely new. Like, they had literally just finished their orientation either the same day or the day before. So we're talking about baby nurses here, which is weird. It would be unusual for...
Usually you have like a senior or somebody like...
Yes. Yeah.
More...
Right, like a charge nurse.
Yeah.
Yeah, charge nurse, yeah. Okay, so these two nurses start to increase her Pitocin dose, I guess, to kind of speed things along. Well, when you start to increase Pitocin, the contractions start to get longer, they start to get harder, and that can actually start to decrease the blood flow to the uterus, which then gives blood flow to the baby. Mm. So that's not a good thing. And when that happens, you will start to see signs of that in the vital signs of the baby that they're taking, you know, like decelerations of the heart rate or other things that signify, hey, baby's unhappy. So apparently, according to the reports, that was either ignored or just straight up overlooked. And so at this point, somebody might ask, what about the doctor? Well, there was a doctor on call at the hospital. But allegedly, they tried to call him. I didn't say if it was a him or her. They tried to call the doctor, and they didn't respond. You know, even though the doctor was in the hospital somewhere, but they couldn't get a hold of the doctor. So they just kind of kept going, pushing this Pitocin. Finally, they got a hold of the doctor at one point. It wasn't exactly clear what they said to the doctor, but the doctor said, okay, noted, and then reportedly went back to sleep. So this poor lady who came in the hospital in early labor was put on these, what is being called very, very high, unsafe doses of Pitocin, and she was there for over 24 hours. And allegedly, the baby's vital signs on the monitors were not doing great. And either it wasn't noted, it was overlooked, or maybe because they were so new, they didn't know what they were looking at. And instead of the right thing happening, which would be to go ahead and do a C-section, you know, once in labor the baby starts to struggle or starts to get into trouble, the correct answer is, if you can't deliver, do a C-section.
Right.
Now that's the answer. Get the baby out, you know, because at that point, you know, the baby's not dependent on the uterus, and you know, if it's under stress because of the delivery, you need to solve that problem, and that didn't happen until over 30 hours after the patient arrived to the hospital. So unfortunately, the baby named Azalea, did survive, so that's good, but was apparently born with pretty severe brain damage. And allegedly will require lifelong care due to the lack of blood flow, hypoxia, and ischemia to the brain. Baby's super cute. I got a picture of the baby and family. Throw it up there, Andrew. Yeah, baby's really cute. Nice family. So of course, this case ends up in a lawsuit, right? You know, it's mom's in labor for long periods of time, you know, questionable issues with the whole delivery process. So the family gets lawyers, and of course the lawyers are claiming the following things, right? So we're kind of going over to the more legal aspect. So the lawyers claim that there was inexperienced nurses mismanaging the Pitocin dose, okay? They also claim that they ignored the alarming signs and the fetal heart tracings showing fetal distress. So that's what they look at. Look at heart rate of the baby. I would assume that the baby had decelerations. Baby's hearts usually run really, really fast, right? And so when the baby starts to struggle, the heart rate will start to go down, and that's a sign, okay, something's happening. And apparently they didn't do anything. They alleged the OB on call was unresponsive, asleep, and ignoring the situation. And in summary, the C-section was severely delayed, resulting in a hypoxic ischemic brain injury, which will require this lifelong care. So apparently the defense in this case was a total mess. After this happened, the hospital, that Jordan Valley Medical Center, actually declared bankruptcy. Shocking.
Dang.
And apparently they weren't paying their lawyers, because the lawyers for the defense finally kind of walked off the job.
Yeah, it sounds like because they probably had other lawsuits against them.
They
were like, hey, you've got another one and you're not even paying us, is what it would sound like.
The lawyers are saying that they weren't getting paid, and so they left the case. And then it was up to the hospital to kind of jump back into the case, either with their representatives or new lawyers, and they didn't do that. And I think that made the judge angry. I'm sure the judge is angry, hearing this bad story, this poor little girl had this outcome. So Judge Patrick Coram finally made a pretty big judgment and a very scathing rebuke to the hospital. The judge said, and I quote, "The mother would have been better off delivering this baby at the bathroom of a gas station or a hut somewhere in Africa than in this hospital. Literally, this was the most dangerous place on the planet for her to have given birth." Wow.
I mean,
that's rough. So a judge awarded a staggering $951 million verdict to the family, that's pretty crazy. That's an insane amount of money. But the problem is this hospital is declared bankruptcy, right? So the hospital declared bankruptcy, they probably owe money to a bunch of people, and now there's a question of, what's going to happen to this judgment? I'm sure they don't have an extra $1 billion laying around. So is the family going to recoup that? Which they need that money if the little girl requires lifelong medical care.
Yeah,
that's expensive. And looking at this, at least from the information that was all over the news, I mean, it sounds like clearly there was malpractice that happened here. So this is kind of a sad and really shocking reminder that childbirth is a dangerous event.
It is.
And things can go wrong, sometimes quickly and sometimes slowly, as it was in this case. And you really want very experienced people that are paying attention, looking at all the details of the labor and the delivery, because bad decisions or things that are overlooked can have lifelong problems,
right?
For the baby, or death for the baby or for the mom. And I think that probably the worst part of this is this was completely preventable. If the baby was having issues with the delivery or with the labor, then the answer is just do a C-section. I mean,
right.
They had a doctor in the hospital, and maybe it was because they couldn't get a hold of them. Or
how early was her pregnancy?
She was 39 and a half weeks.
Okay.
So it's like totally term, anything after 38 weeks or whatever is considered term.
Yeah, I had high blood pressure, and they were like, all right, get her out.
Oh, did you deliver early?
Just a little bit, like a couple of weeks.
Oh, okay. Well, yeah, that's not too bad, but
yeah.
But yeah, this is really sad. I mean, I hate anything involving kids, because that's just, I don't know. I probably shouldn't feel it, but I always feel like it's worse when it involves a child.
It's just kind of silly that the nurses would keep doing something without authorization from a doctor.
Yeah, it is weird, and maybe there was more to it. I looked at.
I don't know. It's just so weird.
It doesn't make sense, right? And I looked at multiple articles about this, and they were all very consistent, because I assume they all probably took from the court documents. I mean, there was a couple court documents I could access, but it was just really generic stuff. But all these, it was all over the news when this happened. I don't remember. I didn't see it when it initially went down, but. It was pretty consistent that basically they just kept pushing this drug, which is a good drug when used properly and when monitored, but they didn't monitor, and they kept doing it, and baby got in trouble and nobody did anything, and I mean, it's just inexcusable.
Nope.
So, All right, let me recap this one, Andrew. So today on Nip Talk, we were doing another true malpractice story about a very, very sad story where a woman who was actually on vacation away from her home went into labor and had to go to a hospital where they didn't know her. And she allegedly got assigned a couple of inexperienced nurses who were brand new, and they started giving Pitocin, which is a very normal drug that women take whenever they go into labor to kind of speed things along. But the baby's got to be monitored when you put people on Pitocin, especially if you start cranking up the dose. And allegedly that did not happen. Also, to make things worse, the doctor was on call, they couldn't be reached or was asleep, and allegedly wasn't answering any of the phone calls. So this poor lady was on Pitocin for around 30 hours. And in the meantime, the baby was struggling. The baby was not getting enough blood flow. So eventually a C-section was performed, but sadly the baby had a pretty severe brain damage from low blood flow and is going to require lifelong support. This ended up, of course, in a lawsuit. The judge gave a very scathing rebuke to the hospital, saying it was the most dangerous place on earth that this poor lady could have delivered a baby, and gave down a $950 million malpractice verdict to the plaintiffs. Sadly, the hospital is in bankruptcy, and it's unknown if that patient will actually see any of that money. But very sad story, big reminder that pregnancy is dangerous, and when people are in labor, you got to monitor, and if things aren't going, you got to accelerate the situation and get the baby out. So if you want to learn more, check out the segment.
Yes, and don't travel.
Yeah, that was the other thing too. Traveling when you're very late-term pregnancy is, I mean, I get sometimes you have to do it, but I mean, there's some risk associated with that.
Yeah, I used to travel for my job and I was pregnant, and I told them I was like, at this point, I'm not going anywhere.
Right. See, smart. That's really smart. Okay, I got a totally crazy story for you guys.
Okay.
I know, right?
Another one.
And it's not out of Florida. I know you're going to say that, Sarah, but okay, so this is sad and also very bizarre, but this is a segment about a actual surgeon who had his own healthy legs amputated, which eventually resulted in him being thrown in jail. So yeah, there's a lot to unpack here. So this didn't happen in the United States, this actually happened in the UK. This guy is a vascular surgeon, 49-year-old Dr. Neil Hopper, lives in England. So he was recently sentenced to 2.5 years in jail for insurance fraud after he claimed that his legs, which had to be amputated, were amputated because he had sepsis, right? So sepsis is a blood infection. If you get really severe sepsis, you start to go into multi-system organ failure, your heart starts to not work as well, and it's not uncommon that the extremities will, especially the lower extremities, will start to get ischemic and tissue will die, and you can very certainly, require amputations.
Right.
So that's what he was claiming, but in reality, after some investigation, he forced the amputations to be performed, this is the even weirder part, for his own sexual gratification. Which is
sexual gratification.
Yeah, I'll explain, but yes, it's still weird. Even when I explain it, it's still weird. Apparently this doctor was a paying customer to a amputation/sexual gratification website where they have amputation videos. I don't even know, is that like some dark web stuff? I don't know what all that stuff means, and I definitely don't want to know. So what this guy did is apparently had this fetish, and we'll talk about what the actual diagnosis of that is, but he had this fetish about being an amputee. So he bought 40 pounds of dry ice. So what is that? It's frozen carbon dioxide, I guess. Isn't that right?
Yeah.
Andrew, you look like somebody knows what dry ice is.
Yeah, that's right. That's
okay,
right.
All right, thank you. All right, I don't mean that in a bad way.
No, you're good. You're good.
I didn't know Sarah would know what dry ice was. I mean, I think it's carbon dioxide. Okay,
I don't know the chemical name, no.
Yeah, so I think it's frozen carbon. So a guy got 40 pounds of dry ice and wrapped his feet and his legs in dry ice. So he basically gave himself severe burns/frostbite, and then he called 911. So of course, the ambulance comes, picks him up. Guy's got dead legs. His feet and his lower legs are dead, and ends up in the hospital. And he pitches this story that I had this. These were infected. So he gets his amputations. Okay, and then what he does is he tries to claim insurance payouts, so like disability payouts, because now he's disabled, right? He's double amputee. So he collects $600,000 in insurance payouts because of his amputations. And this is the crazy part. He was even featured on UK television about the courageous doctor fighting to return to work after infection and sepsis claimed his legs and he had to be amputated. But eventually they figured it out. Allegedly what happened is he made comments on this weirdo amputation website that he had done this to himself, and it got out, and then suddenly the whole story started to unravel. And then of course, because he claimed disability for his legs being amputated for a medical reason, when in reality he did it to himself, that's fraud. So then he got charged with a crime and was convicted, and now not only is he an amputee, but he's in prison.
And a pervert.
And also, yes, some sort of pervert. Yes, I think there was like some sort of like weird sexual gratification stuff.
Hey, it just goes to show you that doctors are humans too, and they can be perverts.
They can totally be perverts, and like it's crazy to think this guy was out there treating patients when he was obviously kind of mentally unwell.
Yeah, thinking about
amputating stuff.
He's like.
Well, it's weird too because
did he ever work on anybody that had amputated?
I'm sure he did
stuff?
Because vascular surgeons very commonly end up doing amputations. So what'll happen is a vascular surgeon will get a consult for, hey, this patient doesn't have good blood flow to the foot or to the leg, right?
Well,
and
God
so they'll
knows
try to
what he was doing.
Yeah, he may have been.
People were
You're absolutely right. I mean, that's certainly worth considering
disgusting.
That he got into this because it involved amputations, or maybe his amputation fetish spawned because of his work. I don't know, and it brings into question, like, was he amputating people's limbs that maybe didn't need it? I don't know.
Through that website.
Yeah, who knows?
He's grooming people to get amputated.
I don't know, man. It's just a really, really weird story. It makes me uncomfortable to talk about it. So this is a known disorder, right? And I think we talked about it once, maybe a year or so ago, about body integrity identity disorder, BIID. So this is an extremely rare mental disorder where someone basically has a very strong desire to either have an amputation or to be paralyzed. That's another one. Or to be blinded. Basically, they want to be disabled.
Like romanticized it in their head.
Yeah, and there's a lot of like sexual gratification. Not always, but there is oftentimes sexual gratification.
Yeah. Didn't we talk about that one mom and daughter that like she convinced the world and made her daughter pretend to be like some type of like.
Oh, it was the Munchausen's, right?
I don't know.
Yeah. Excuse me.
And I think she like convinced the world and made her daughter like act disabled. To like,
that sounds familiar. Man, we've done so many segments I can't remember. I'm going to look back.
Yeah, I'm pretty sure we talked about that.
Yeah, that
it was very weird.
That could have been a body integrity identity disorder by proxy, right? So instead of her having it for herself, she had it for her daughter.
Yeah.
Yeah, they call it that by proxy.
Oh, I remember. She went to jail. I think she killed her mom. Isn't that who that was?
I think that is.
I don't remember.
She ended up killing her mom, and I remember, and she went to jail, and she was interviewed by Kim Kardashian.
We must not have talked about this.
Yeah, it was just me watching
it was
the
just you
Kardashians, maybe.
Yeah, and you thought it's really weird, so it's probably something I said.
Yeah. He knows.
Yeah. No, I don't. I'll have to look that one up. I'm not familiar with it. Maybe we'll do a segment on it. I don't know.
Yeah, see what she's up to. This girl.
Yeah, right. I don't know. It sounds vaguely familiar, so maybe I saw it too.
I think we talked about it.
Did we talk about it? Okay,
Gypsy Rose.
Yeah.
Oh, Gypsy Rose.
Yeah.
Yes, I do remember. I think we did talk
I
about
think her
that.
mom was making her, or giving her
have
pills
cancer.
making her actively sick. Yeah.
Yeah.
Or maybe convincing her that she was sick.
Yeah,
Crazy.
and then like she hung out with a boy, and the boy convinced her like the best way out of this is just to kill her.
Oh my God.
And I was like, maybe just stop taking the pills and leave.
Yeah. I do remember. We did talk about that. I don't know if we did a whole segment, but we did briefly talk about that one. But yeah, this is a crazy thing. I mean, body integrity identity disorder is insanely rare. And what's crazy is there was a time when some surgeons were basically honoring people's requests to have amputations, and one of the articles I was reading was about some surgeon in Scotland that would basically amputate your limb if you wanted, even though you didn't need it. Because obviously the overwhelming majority of
Almost
doctors.
like it's like plastic surgery to a weird extent.
Sort of, it's body modification, but yeah, you get into a very, very gray area about, patient autonomy and wanting to do something versus, what's actually morally justified.
Yeah, I feel like that goes against y'all's moral code.
Yeah,
like causing
disabling
no harm.
someone, obviously, to me, is that's causing harm. Yeah, you're not helping someone.
Yeah, that's weird.
Because people playing devil's advocate will be like, well, what's the difference between, plastic surgery where you're doing body modification and this? Well, obviously, if you're amputating someone, you're disabling them. Like, that's not helpful. Like, no one's better off being disabled.
Yeah, that's weird.
Yeah.
It's unfortunate.
It's unfortunate. It's sad. And now this guy's in jail. He's going to come out and he's doping. I just think it's crazy that he basically was in the spotlight on television in the UK. It's like, surgeon fighting for, to get back to his career after terrible accident.
I think that's a part of that, romanticizing that
Yeah.
type of amputation thing, because they get to play the victim for the rest of their life.
Yeah, exactly. Yeah, could be. That could be a big
People
part of it.
feel sorry for them forever.
Yeah, big one. Okay, all right, let me recap this one real quick, Andrew. Today we were talking about the crazy story of Dr. Neil Hopper, who is a vascular surgeon in England. And Dr. Hopper is now currently in jail because he had his legs, which were completely healthy, amputated on purpose. And the way he did that is he coated his legs in dry ice, which caused them to necrose, and then they need to be amputated. But here's the problem. He then claimed with his insurance that his legs were lost due to sepsis, which is a blood infection, which can require people to have amputations if it gets severe. And so he basically committed fraud. And so therefore he now is in jail for that. And the crazy thing is he talked about in the UK news before this all came out about the surgeon fighting to get his career back after sepsis claims his legs. In reality, this poor man had body integrity identity disorder, which is a very, very, very rare psychiatric issue where people have this overwhelming desire to be disabled, whether it be through an amputation or paralysis or being blinded. It's pretty crazy stuff, and we've talked about it a time or two, but man, this is one of the wilder stories that I've heard, and a vascular surgeon no less. And Sarah even brought up is this guy doing amputations on people for his own fetish? Who knows? Who knows what happened? But yeah, pretty crazy story. So
yeah.
All right.
Strange stuff.
All right, so last one, Sarah.
What's next?
We're going to do plastic surgery news recap.
Okay.
We did this before, so I'm going to basically do a really quick 1 to 2 minute talk about something, and then we're going to discuss it.
Is it like a where are they now situation? For
no,
things
these aren't like redos. These are like new stuff that are just kind of like really quick stories. It's not like enough for a whole segment. So, okay. First up, North Korea. I always love the North Korea. Bans boob jobs. Kim Jong-un, pictured right there, says boob jobs no longer, ordered an emergency crackdown on breast augmentations, claiming they were anti-socialist. He sent strike teams, literally sent strike teams, into central areas looking for either black market doctors performing boob jobs or busty women. Patients or doctors in violation could face criminal punishment, and over there, punishment is actually legit. Labor camps on charges of anti-socialism because he fears the citizens are being corrupted by a bourgeois customs and capitalism. So this brings up the question, is Trump going to do something and send in the military to make boobs great again? I don't know, probably not, but this is a pretty wild story. I didn't realize that breast augmentations were so threatening to socialism.
Yeah, who knew that boobs were
Boobs are so
socialism
dangerous.
Issues. That's weird.
I mean, I guess, and I'm trying to like understand this. I guess maybe the thought process is that, aesthetics and that is buying, I guess, into consumerism, which I guess could be considered capitalism.
They want everybody to be the same, act the same, get the same. And if somebody's walking around with double D's and some girl has an A cup, what are they going to do?
I guess that's true, right? Because that person is then higher in social status because they have larger. Okay, that makes more sense.
They want everybody to be in little. I feel like whenever I think of that place, I think of gray.
I do too. I feel like
nothing's bright, nothing's dark. Yeah. Everything's just blah.
Everything's the same and boring.
Yeah, and that's what they want.
Everyone has small breasts. It sounds very sad, honestly.
Maybe he's like,
I mean, to me, that would be like
women with bigger boobs have opportunity to make more money or something,
Yeah.
What's funny is that he's probably has had women with plastic surgery all around him before.
Right, he probably's got like a harem or something.
Yeah, he's probably got like a weird little room that he can just open and go in there, and there's just women in there.
Maybe he's like snatching them all up to be part of his personal.
He's sending in strike teams to.
Yes, sending in strike. It literally said strike.
To gather all the girls with the big boobs.
I know, it's crazy, right? And I personally, I feel if I was a North Korean, I mean, obviously I would be super unhappy, but I don't know if I would want to break the law over there. Like, it's
can you leave that place?
No, that's part of it. It's like the Iron Curtain. Like, leave the country?
Yeah. Like, you can't just be like, I don't want to live here anymore.
No.
This is weird.
They're not going to let you leave, I don't think. Andrew, weigh in. Can you just leave North Korea?
No, I don't think you can. Like, there are hard borders.
Can you escape, though?
People do try to escape, some successfully, some not. Yeah.
Yeah.
What I'm also confused about,
okay,
I think going back to what you said, it wasn't just people who are having plastic surgery, but just naturally larger-breasted women as well.
Well, they were getting it. Yeah, okay, so I'll clarify.
They're going to pat them down to see if they have
So it said that, yes, they were looking for busty women, which then would have to have an exam. So, like, if you're just walking around with natural D's, man, like the breast strike teams come in, and you got to prove that, like, they're real. I don't know if that's done with like an X-ray, or is that like a field test? I'm looking for I don't know. Like, how does that work?
That's a great question.
Dude, you know what they need to do is they could do fat grafting augmentations, and then there's no implant. Boom, right? See, I could be a black market North Korean plastic surgeon.
You could.
I wouldn't do that. I wouldn't risk my life, for a few bucks over there. It's like, what are you going to spend your money on? Like another gray outfit? No,
yeah,
I'm not,
literally.
I know, man. It's like, I don't know what I just would.
Spend your money on nothing is what would happen.
Yeah, exactly. Yeah, another picture of great leader, another poster.
Yeah, spend your money on government.
I would spend my money on trying to get out of that place because it sounds terrible.
Sounds like it.
Yeah, North Korea is a bum. I'm gonna give North Korea a thumbs down, like a 1 star.
Yeah.
Do not like.
Scary place.
Yeah. Okay. All right. Let's move on to our next one.
Okay.
So, Jennifer Lawrence, who we all know and love, made an appearance at Paris Fashion Week, and it sparked a frenzy of social media outcry where people were claiming that they wanted to arrest every plastic surgeon in Los Angeles and Hollywood. Okay, so 35-year-old actress goes to Paris Fashion Week, and to the dismay of all her fans, allegedly, she was unrecognizable. I'll let you two people be the judge. All right, let's throw up the first picture.
Okay.
I mean, it looks like her. What about that one? I mean,
it all looks the same.
Yeah, I think it's all like the same day or two that she was at Paris Fashion Week. Yeah.
She looks the same.
You think she looks the same as before?
Yeah.
I mean, I definitely recognize her, but she does have a little bit of a different look to her. People were, you know how the internet is, man. They were going off the rails, saying that everyone needs to lose their plastic surgery licenses, and she looks like Dakota Johnson or Ivanka Trump or Sabrina Carpenter or whatever. I personally think she looks the same. If I had to, say, okay, why does she look a little off? I mean, one, the haircut. Mm-hmm. Like, she's got bangs now. I don't think she ever had bangs. She's doing a lot of contouring makeup. That's a lot of contouring makeup, I think.
To me, her cheeks look slimmer. She's always had very
puffy
puffy
cheeks, right?
Mm-hmm.
Yeah, people were saying,
like
she's had buccal fat removal and all this.
But maybe she's lost some weight.
She may have. I think she may have had a little bit of filler. I mean, when I look at her, there's a couple things where I'm like, oh, it's hard to tell, is this like a makeup contouring or did she actually have some filler? Mm-hmm. But I mean, I don't think she had surgery. To me, I look at her and I do think she looks different. Like, I look at her and I'm like, okay, that's Jennifer Lawrence, but she looks a little off to me.
She looks older.
And she is getting older. She's, we were used to seeing her when she was 20, and now she's 35, which is very still young, but definitely older.
But she hasn't really been in any big movies lately. She kind of got canceled for a little bit.
Why did she get canceled?
I don't know what she did. She did something, and everybody was like, ew.
No way.
Yeah.
They canceled Jennifer
Yeah.
Lawrence? That's her name, right? Mm-hmm. Yeah, Lawrence. Yeah.
Yeah, she did something, and everybody got mad at her about it.
I wonder what she did. Andrew, what did Jennifer Lawrence do to get canceled? Do we know?
Let me look it up.
All right, we're going to find out.
Yeah.
But honestly, we definitely talk about people who look completely different. The one that to me comes to mind is Gwen Stefani. Yeah. She was unrecognizable. Madonna, unrecognizable. I think Jennifer Lawrence she looks different, but I still recognize her. Mm-hmm. I don't love the hair.
Maybe it's kind of like how, like what Lindsay Lohan, Lindsay Lohan was going through stuff, taking drugs, being an alcoholic, for a little bit.
She looked different because she was strung out.
Yeah, and then now she's a little bit healthier.
She got her act together.
Yeah, and she looks like fresher
Yeah.
and stuff, and now she looks like amazing. So maybe like Jennifer Lawrence did some
soul searching.
Like she's just more fit, maybe. Like we don't know.
Yeah, she could have lost some weight. I mean, you're right. She did have like a little bit of natural baby fat. She looked
more slender.
Yeah, she does.
Her face.
But I don't think she had surgery. I think the internet, as usual, is overreacting. So yeah, I'm not buying the outrage.
Yeah.
You're selling the outrage, and I'm not buying it. Did we ever get a verdict on the cancel? Did that actually happen, or are we making that up?
It does look like it happened. It doesn't look like from any specific thing, just a kind of a series
People
of
were just like, we're tired of Jennifer Lawrence, you're done for a bit.
She was claiming that she was like the first female lead ever in an action movie and like very big-headed and kind of rude.
Okay, so she just like said some dumb stuff. So nothing bad.
Yeah.
Seemingly nothing bad.
Okay, all right, very good. Okay, all right, let's move on to the last one. We originally did a segment about this, but again, cosmetic surgery chains are under fire. There was a new NBC News article that I got right here talking about all the cosmetic surgery chains. They named all the big ones: Goals, Mia, Aesthetics, Sonabella. And basically they just talked about the same things that we talked about in our segment a month or two ago, stating all the numerous lawsuits that these places are fighting or have had to fight. Talking about improperly trained surgeons, which I always talk about that these places will hire a general surgeon or like an ear, nose, and throat doctor to do plastic surgery.
I think that's the weirdest thing.
It's so
ENT.
crazy, and it's just, it drives me absolutely bonkers. And some of the places will claim that they get a fellowship of like a week or two, which, my fellowship for plastic surgery, I did almost 3 years of training.
Yeah.
And it's at least 2, if not 3. So they were talking about that. A lot of the surgeons have bad histories where they had either multiple lawsuits in the past or had actions from their medical boards in these different states, and then they have to basically leave that state because they can't practice medicine there anymore. And then finally, one of the things I didn't talk about a lot when we were talking the last time about these plastic surgery chains, and this is super, super shady, and I really hate it, and there should be a law against this. They basically coerce patients to sign a release form that says that if they have an issue, that they have to go to arbitration versus a malpractice suit. And that's how a lot of these places dodge these malpractice.
Arbitration, what does that mean?
Basically, they have to go in front of a third party to, discuss what happened. And so they can't go the normal route of a malpractice lawsuit. And because of that, a lot of these, patients who get, injured or have these terrible outcomes, they end up not being able to sue them.
Gosh.
And it's super shady that they would make people sign that. And they probably are not being very upfront.
It's kind of like signing an NDA before you get married to somebody.
Yeah, sort of like that. Yes, except yes, but no, but yes.
It's kind of shady.
It is shady, yes, yeah.
Like why do I have to sign this?
Yeah, why are you doing that? I would tell anybody that whether they go to an individual surgeon or, God forbid, go to a plastic surgery chain, which I am really against these plastic surgery chains, don't sign something that says that you don't have recourse if something bad happens.
Yeah.
I mean, that's very sketchy. I would never have any of my patients sign something that says, okay, if you get messed up, like you can't sue me. I mean, to me,
that's like a release form. Like
yeah,
when you go to a
release
gym.
Yeah, it's like
That's
nuts.
weird.
Like, the fact that they can even do that just makes me kind of angry.
Yeah, that's weird.
Yeah, so plastic surgery chains.
Straight to jail.
Bad. I'm happy that they're getting a lot of bad press. because when we talk about all these, bad, not every single one, but there are a lot of bad outcomes. I mean, we've talked about them on the show for 3 years, and it's like, the patient travels to this place and something bad happens, and the doctor ends up being, not a plastic surgeon, and then the doctor can't take care of them because they don't have hospital privileges, and I mean, it's just a mess.
Well, it seems like that's just where you're going to find them, at those franchise places.
Yeah, the franchise.
It's like, there's doctors that are floating around that aren't like certified and all of that stuff, but it's kind of almost
kind of
guaranteed.
Cluster. They're like a hive.
That it's like,
it's like a den of iniquity.
Yes, like that's where you're going to find them.
Yeah, totally. And the sad thing is, these places have these, big budgets and all this marketing, and so on the face of it, it looks pretty legit. But man, when you start to dig down to it, it's super sketch.
Yeah.
So
it is.
Be warned, people.
Don't go there.
Don't do that. Okay, well, I think that probably is all the time we have for this week. We really do appreciate you tuning in. Please leave us a comment. If there's something you'd like us to talk about on the show, we will do it. All you have to do is leave a comment. So we appreciate it, and we will see you next week.
Bye.